All right, so now we get into nerve stuff. Okay, so what are the two nerves that we talked about that are affected in the elbow? There is, if you remember, there's the musculocutaneous nerve that comes off the brachial plexus that does more stuff into the elbow, into the upper arm. It has a branch that continues and goes across the elbow, and it's the lateral cutaneous nerve of the forearm. So if that nerve is affected in here, you can get, like numbness tingling on the lateral side of the forearm. So basically, cubital tunnel syndrome, it's impingement of the ulnar nerve as it goes through the cubital tunnel. And that tunnel is formed by the ulnar collateral ligament and the flexor carpal ulnaris. The second most common entrapment of the left extremity. It's repetitive elbow flexion and wrist extension. And then also pronation and valgus stress here. The main thing is this type of position. Okay. So if we're going to do a special test, if this is the position that aggravates it, then let's just do this. Okay. That's the special test. Okay. So what it's doing is it's stretching the nerve. Okay. Here's the nerve right here at this point is slack. Now we're doing this to stretch it because it goes across this tunnel right here, and then we're doing this to pull on it up here. It's the same thing like when we did this other, slope test and things where we do this. This is pulling the nerve here, and then we just add that. So we're doing this, and then we're just adding that. So it's just a nerve traction test. Okay, so then the way that's going to happen is repetitive movement like this. Or if somebody's sleeping like this, you may wake up with problems like that. Another thing is people that, if you're sleeping like this, the other thing is it'll be carpal tunnel problems. So a lot of times, if you've heard of those cock-up splints, like if somebody's having carpal tunnel problems, they'll have them wear the splint at night so they close the wrist in a position like that, so they're not doing this or doing this. So the pathology is basically inflammation of the ulnar nerve, chronic compression or stretching of the nerve. Okay, there's our friends. All right, so what's this? The defect in the ulnar nerve distribution in the hand? Yeah, in this case, it's the back and the front of the last two fingers. Okay. So if it affects it long enough, you can have weakness, tenderness. All right, so then it's a nerve. So what kind of special test are we going to do? What do we do to nerves? We either poke them or stretch them. Or something where you're going to close that tunnel off. There's not really any test here where you're going to close that tunnel off, so we're doing this to stretch it, doing this to tap on it.
What exactly do you experience in these fingers if it's hot?
Most likely it's going to be numbness and tingling. Could be pain. But when somebody says it's numbness and tingling, that immediately lets you go up in your head. That sounds like nerve. Okay? Especially if you have weakness, other things like that. If you have a loss of grip. So then now we get into pronator syndrome. Okay, so then what nerve is that again? There's three nerves. What nerve is it affecting? Median nerve. Okay. So then the pronator muscle, that's so then it's happening down into here. Here's the nerve coming down in here, and then there's the part of the pronator teres muscle. So we'll talk when we have this cubital fossa, when we talk about palpation and such. One of the borders of it is the pronator teres. Because pronator teres, if it comes off of this medial epicondyle, it goes on to what bone over here would it go to? And then what's going to do is going to go like that to pronate, right? So when it contracts, it's going to shorten like that. So that muscle gets stuck in there, that nerve, then you're going to get irritation. Now you could feel it starting from here down, right? So they get numbness and tingling in the forearm, and then it's going to go into the median nerve distribution into the hand. So it's going to be repetitive types of things, repetitive pronation. If they're doing gardening, shoveling, something like that, and weightlifting. So the muscle gets hypertrophied, and it's just basically squeezing off the nerve. So they can get pain and aching in the forearm. They could have weakness, numbness, tingling. They could have edema, hypertrophy in this area. You might go in there and palpate and you feel this like ropey, knotted muscle.
What is WNO?
Anybody else, did I go over that yet? Anybody take a guess? Let's see, it's talking about range of motion. So what WNL means within normal limits. And so then we know what the MMT is, right? Manual statistics. Yeah, if there's any, a lot of times there's these three-letter acronyms, you see them all the time. If there's any of you not sure of, just let me know.
What is Bush mean?
What's that? Great, somebody can help her out with that?
Only got an outstretched hand.
Oh, okay.
All right. So we get into examination. So first thing you do is what? What's the first? H. Right, we're doing H, O. So history, how did it start? The whole story. Those parts, tell me what happened. Basically, I'd say the main couple questions that you're going to want to know is, was it acute onset or was it repetitive trauma? Okay. Is there any, and in this case, if we're just talking about that, but if you're talking about, from here down, is there any radiating symptoms? Does something start up here and then go down? So then you're going to think, nerve root problems. Because, somebody says they have numbness and tingling in here, going back to the cervical, you want to know, is it nerve root problem coming from here going down? Is it pronator teres syndrome here? Is it carpal tunnel? Is it the nerve root or is it a peripheral nerve? What makes it better? What makes it worse? All right, so carrying angle, I think I have that on the bottom of the, isn't that? Yeah, so carrying angle, you can pretty much tell from this what that is it, instead of the elbow, at the elbow, instead of it going straight down into the forearm, it varies out like that. Some people, the average is 10 to 15 degrees, some people are going to have a variation on that. Okay? It's going to be a little bit higher in females. Then, of course, you're going to look for swelling, epicondylititis. Again, you could have swelling here, epicondylitis, things like that. So basically, in elbow range of motion, we're just talking about two different planes, right? Or two pairs of movements. You have a paired movement of flexion and extension, pronation, supination. So we talked about the normals of being 140 to 150. But just a quick average type of thing to just basically, you should be able to come within your fist's length or distance between the wrist and the shoulder. So you should be able to come within that amount. Right? So we'll put fulcrums and all that stuff. But basically, elbow's pretty simple. Here's 0. If they have extension, it's going to be 0 is pretty much normal, but they might have a little bit of hyperextension. And then pronation, supination, the way you usually measure it, you just put something in the hand like this. If you don't have one of these, you usually use a pen. Right? Or you can hold your thumb up like that. Right? No. So then you just measure here. So basically, this is your reference point. You have a line going through here or something held in the hand. This would be 0, so then you're going to measure this way. And as you can see, supination is going to be a little bit greater than pronation. And then 5-minute neuro, it's the same thing all the way from the neck down. You do dermatomes, myotomes, reflexes. Then palpation. So why don't we could take a break at this point, and then we'll start in with palpation when we come back.